these are not serious pay demands. And I really struggle at this point with the argument that they're out there picketing for better services for their patients in the NHS. Patients' lives are being put at risk by the strike. We know that there's going to be horrible repercussions for those patients. It's an estimated 350,000 appointments and procedures will be canceled over the next 4 days. Women's cesareans, planned cesareans are being canceled. People aren't getting their cancer diagnosis. Let's not pretend that this is for patients. And if you want to talk about pay, look, your average junior doctor is earning, it's quite a wide range, between £25,000 baseline minimum up to almost £70,000 baseline minimum. And that is not before you calculate what they're earning extra for weekend work, night shifts, unsociable hours.
But on Twitter this afternoon, a second-year junior doctor put his payslip on. It's £1,823 here last month. Now, there'll be many people listening to this programme who don't get paid as much as that. But if you, as Natalie said, if you've gone through however many years it is of training, the student debt that you've built up over those years, you might expect to earn a little bit more than that.
Hold on, we can say that about so many professions, and there's so few professions where your lifetime earning is going to come anywhere close to what a doctor can earn. So, and we also need to factor in pensions here too, right? Taxpayers are on the line for paying 20% into doctors and nurses' pensions. So maybe we need to have a conversation and rejig how much money they get up front. Let me finish. Maybe we need to have a conversation to rejig what money they get up front compared to what we're paying into their pensions. But there's a reason that the lifetime allowance was lifted in the last budget to get more doctors back into work. Over the course of your lifetime, this is an extremely well-paid profession. Many people will empathize with not getting inflation-based pay raises because the average pay raise in this country is below the rate of inflation. Doctors are not unique in this. I do think their working conditions must be addressed in the same way patient conditions must be addressed. But the idea that these are, in any real way, low-paid jobs, especially over the course of one's lifetime, it's ridiculous.
But compared to other countries, they are. And that's part of the problem, it's staff retention.
Yes, compared to other countries, and I would love to adopt some of those countries' healthcare systems, right? You want to start talking to me about the German system, the Australian system, the Netherlands, you want to even talk about France? We can talk about why in those systems doctors get paid more money, but you cannot, on one hand, refuse to talk about reform, as Phillip has mentioned, always say that that's a backdoor to privatization, which it is not. You cannot call yourself a public servant and say, I'm working for the state in this monopoly on healthcare that we think is a public good, and then on the other hand, demand the kinds of salaries that you get from more free market healthcare. You can't have both.
Ollie Dugmore, are junior doctors' pay demands fair? That's what Cara wants to know.
Yes.
So how would you pay for it?
Is that all you have to say?
Would you like, we can get into it. How would I pay for it?
Yeah, how would you pay for it? Where are you finding that money?
Taxes. Tax the rich, tax them until the pips squeak.
So genuinely, what taxes are you raising?
Hang on,
who am I arguing with?
Let Ollie set out his stall.
There is money in our political system. Where it gets spent is a political choice. Let's talk about the £4 billion in unusable PPE, a lot of which that money went to Conservative Party cronies, peers, donors. It is an ethical choice how we spend money in government. And I would challenge people in this country that if they want to go out and they want to clap for the NHS during a pandemic when we were literally sending them into hospitals to confront a disease that we didn't know anything about, sometimes wearing bin liners, those people deserve fair pay. They're not actually asking for an extraordinary pay rise. They're asking for the restoration of what they were paid in 2008. That's not an unreasonable demand.
So do you think part of the solution might be for the government to come forward and say, OK, we get that you've lost this money since 2010. We accept that. We accept that part of your argument. We can't give you 35% now. You don't expect it. There's no way that we can do that. But over the next 3, 4, 5 years, we will do it. And here's the proposal.
Yeah.
Now that, to me, would be the logical way forward.
It's called negotiation.
No, but Iain, I'm sorry. Everybody has lost out. Everyone. It's not just doctors. It's not just nurses. Everybody has lost out. And you can't point to a one-off COVID spend, as irresponsible as some of that spending was. I agree with you. You can't point to a one-off spend and claim that that's how you would fund a perpetual commitment, which again isn't just salary, but is a massive pension on top of that as well, and say that's how I'd fund it. So seriously, you've both said you would 35% is reasonable. How would you fund it?
You'd fund it through productivity gains. One of
no, I'm sorry, Liz. Let's try that. No, I want to know how you'd fund it.
One of the reasons we have low labour force participation in this country is the rise of endemic health and chronic conditions that remain unaddressed. One of the tragedies of our current situation is our NHS performs very poorly against all sorts of international criteria in terms of health outcomes, from cancer to any number of chronic conditions. We have a very poor health system where nobody is in charge, where nobody wants to reform, and where there is no net gain. We also have an astonishingly cheap health system. If you look at GDP spend, the Americans spend twice our GDP on their healthcare.
Because it's very inefficient.
And it's the free market healthcare. And it is not worse.
One in £6 spent by the government is spent on the NHS. How much more would you like it to spend? The
point I'm trying to make is that our health services, actually, if you look in terms of GDP spend, is one of the most efficient in terms of spend.
I'm sorry, it's not. Those figures are wildly out of date.
In terms of GDP spend.
It's not.
What we have is an unreformed, dysfunctional, systemic system. And what the staff need to do is to accept the need for structural reform on a grand scale if we're going to improve health. And that's what's absent from any union demand.
Good luck to any political party that goes into the next election saying we want to have structural reform of the NHS. Natalie.
I've just got to take on Philip's point about our health outcomes, which are absolutely dreadful. But the question is whether you blame the NHS. We have some of the worst housing stock in Europe.
Well, it's multifactorial.
We have a terrible diet. We have terrible air pollution. All of those things have impacts on people's health outcomes.
We also have a 7.2 million waiting list on the NHS. I think the NHS probably has
7.5 by the end of this week.
I think we have some responsibility here to put on the NHS.
But we eat as a society twice as many ready meals as the rest of Europe on average. We also have the second longest working hours in Europe, and pre-COVID we had double the average eating time.
Aren't you?
I'm
on your side, but
and working hours and terrible housing, everything makes people unhealthy because our society is unhealthy. The NHS can't fix those, just as schools can't fix the impacts of poverty and inequality on health and education outcomes.
I'm going to be very unhealthy myself if I don't bring this to a close.